As a PI, my advice to another principal investigator would be the people that work with the animals know the animals better than any other person. And they are the ones that identify issues early on just from observing their research subjects because they know them so well.
Hello and welcome to The Last Word, the official AALAS podcast dedicated to advancing laboratory animal science. I'm Jennifer Smith, Chief Scientific Officer at AALAS, and also your host. Together, we'll discuss current research, emerging trends, and the innovative work that supports scientific progress with animal welfare. We are so glad you're here. Let's discover something new together. Welcome back. In this episode, I am joined by two new friends, Dr. Mia Ruff, PhD. Dr. Ruff is a Postdoc-toral Research Fellow in Translational Neuroscience at Wake Forest University School of Medicine. She's also studying neurobiological and behavioral mechanisms underlying substance abuse disorders. We're so excited to have her here. And she also is joined by our guest, Dr. Michael Nader, PhD. And Dr. Nader is a professor of translational neuroscience and radiology and the founding director and co-director currently for the Center of Ad-diction Research at Wake Forest University School of Medicine. So that was kind of a mouthful, but I do want to say that Drs. Ruff and Nader are joining me today to discuss their recent JAALAS paper that we are just thrilled to have out there. And it is titled Longevity and Catheter-Related Infection Rates in Nonhuman Primates with Chronic Indwelling Intravenous Catheters. Another mouthful, but I am so thrilled to have these two awesome researchers, new friends, colleagues, like-minded people traveling this earth, and I want to give them some time to introduce themselves. So Michael and Mia, take it away.
Well, thank you very much, Jennifer. I'm Michael Nader. My interest is in behavioral neuropharmacology. It started, I'm a native Michigander. I was an undergraduate at Wayne State in Detroit, and it was at the time pre-med. Took a physiological psychology course, and there was a section on, at the time, called psychopharmacology. And there was a study that they described in the book on the behavioral effects of drugs varying depending on the rate of ongoing behavior, totally independent of how it was acting in the brain. And I was smitten and taken back by that. And I started working in a rodent laboratory looking at morphine addiction at Wayne State. And I went to graduate school, University of Minnesota, where I worked on, my research subjects were white Carno pigeons. And I looked at the behavioral effects of methadone there. I did a postdoctoral fellowship at Uniform Services University in Bethesda, Maryland, where I got to work with squirrel monkeys. And then I was a research faculty at the University of Chicago starting in 1988. And that's where I started working with rhesus monkeys and catheterized monkeys in cocaine self-administration studies, which I've been doing at Wake Forest since I joined the faculty here in 1992.
So Mia, let's hear from you.
All right. So I grew up in Florida, and then I went to the undergraduate institution of Wake Forest, and I've stayed there since. So when I was an undergrad, I majored in psychology with a minor in neuroscience, and I actually met Mike my sophomore year of college. He gave a lecture on what monkeys can teach us about the brain. And every semester from that class, I emailed him asking to be in his lab. He didn't take undergrads at the time, unfortunately. But once I started my PhD program, I was in his lab and I finished my PhD there in October. And I studied polysubstance use in these non-human primate models. And so something we know is that there are a lot of FDA-approved medications for certain types of substance use disorders, but we currently don't have anything for stimulant use disorders. And a lot of people who use stimulants co-use other drugs along with those psychostimulants. So I studied in particular the co-use of alcohol with cocaine, and tried to look at novel therapeutics that would work in a population who co-uses substances. And now in my postdoc, I'm moving into also looking at PET biomarkers as well as sleep measures and how they relate to substance use disorders.
Wow. Thank you for that. How fun to just see that a little bit of persistence really pays off, right? So I love that. I love it. I think we all need to hear that sometimes, especially right now when things are a little tough for research. So I appreciate that. And just so much. I'm so excited that you're both on this podcast with me today because what you do is so important on so many levels. And we in the lab animal community, our careers are really devoted to making sure that you have what you need to do the research. And we just take great pride in that. But it is also really wonderful to sort of talk to the PIs and really get to the bottom of how these papers come together. And especially this one that is just provides so much information for all of us to use jointly, which we very much appreciate. And just really to touch base with you guys in this really interesting time in history as far as research. And then layer on top of that the use of primates, which is also very tricky. So gosh, just a lot to unpack there. But I just wanted to say again, welcome. And we're just so thrilled to have you. All right, so let's get to this paper.
Thank you for having us. Happy to be here.
Oh, of course. All right, so let's jump into this paper. We always start with the top. Besides the title, just tell us about your team, because we know it takes a team, and we'd love to hear who did what and why.
Here at Wake Forest, we have a large number of veterinarians, a large number of laboratory animal technicians, and they have helped maintain the health and well-being of our non-human primate colony for decades. It's always been a recurring question about the frequency of catheter tract infections, and mainly that happens when we have a new veterinarian on the floor or a new member of the IACOC. And at some point, it got to be where it wasn't really quite satisfying that I would just say, infection rates are really low. Trust me on this one. And so the team that was put together, Mia started this, and she was mentoring a Wake Forest undergraduate, that's Emery Lewis. And so they started to go over 23 years of history of catheterization, infections, and outcomes of how long the catheters lasted. They recruited and added on some additional graduate students that were on the floor. That's Brianna Roberts and Marissa Costa. And we went through records from my laboratory and then Dr. Paul Zodi's laboratory. That is our team. I would be remiss if I didn't acknowledge the fact that when you read this paper, you'll find out that our catheter tract infections are really, really low. And that's because we have really outstanding people in the laboratory. Michael Collar is the best surgeon I've ever seen, putting in these indwelling IV catheters. Jillian Odom, Crystal Beatty, Susan Nader, Tanya Moore, Cliff Hubbard, and countless number of graduate students. Everybody has to do their own surgeries or be part of those surgeries, have all been outstanding with the help of our animal resources program. That's the team.
Yeah, that's a great big team. That's really great to hear that. And just hearing from a PI and a lab perspective, what it takes to get a paper like this to the finish line, because, right, there was just 23 years of reviewing records. That's a lot, something to be really proud of, and as well as the results. We won't give away the results yet, but I can't tell you how much I appreciate just the nod to the women and men that work so hard to care for the animals, because we know that without them, none of this stuff gets done. So appreciate that so much. Okay, well, let's just jump in. Your introduction. Like a lot of JAALAS papers that we're proud of on the publishing editorial side, the fact that the introductions are well written, just pretty jam-packed with material there. So we would love to know just some more about unpacking that as far as what kind of animals you used, and then more about the catheters, and just kind of what sets you up for your hypothesis, which, because this is sort of a review paper, you were looking at a few things. So more than one or two hypotheses driving this research, but we would love to hear all about that.
Let me just give a brief background on the model. So use of non-human primates and pharmacology, frequently they have chronic indwelling intravenous catheters. For what we use them for, it's to study drug self-administration. So drugs that we humans misuse, animals will self-administer. And we try and study factors that influence that, and then, of course, develop treatment strategies and look at how it's changing the brain. The first study that was published in monkeys with IV chronic intravenous catheters was in 1964. I've been doing this since 1988, and thankfully, the techniques, the surgery, the protocols have all improved greatly. And we realized that there's only really been one study in an animal model similar to this, and that was Taylor and Grady in 1988, where they looked at rhesus monkeys that were implanted with indwelling IV catheters. And they looked at 21 months, not 23 years. And they found that almost a third of those monkeys had catheter tract infections. But those monkeys, the catheter exited the body. It was not like the system that Mia is going to tell you about in a minute, about where these are intravenous catheters that end in a vascular access port. So the catheter never exits the body. And the infection rates have greatly, greatly declined because of that. The goal of this study was really to just document the longevity and the rates of infection of these IV catheters with this vascular access port system in monkeys that self-administer cocaine. And we're hopefully that the information we provide will give people an idea of how best practices are. And really, this is evidence-based research on how things are working.
And if you look at the manuscript, we focused on 3 main predictors there. So we looked at the biological sex of the monkey to see whether or not there's a difference between males and females. We also looked at the location of the catheter implant. And so unlike rodents, monkeys are much larger, and therefore we can implant these intravenous catheters into several veins. So we can implant them into femoral veins, internal jugular veins, external jugular veins. Even done some saphenous veins, which you see in the paper as well. What we wanted to see was whether or not the longevity of these catheters depended on the location at which it was implanted, and whether or not the number of surgeries we have to do after the implant impacted how long it stayed in the vessel as well. And so because these catheters were staying in for over a year, sometimes the skin over that vascular access ports loses its integrity, and so we have to do a repair by moving the VAP around. And so we wanted to see whether or not these repairs would impact longevity as well. And we didn't have any explicit hypotheses because, like Mike said, it was a retrospective review of 23 years of medical records. But we were just in general looking at what factors would impact longevity as well as infection risk in our animals.
All right. That is so great. Thank you for all of that information, and especially for kind of helping us sort of understand the background as well as what the VAPs are, where they were, and then sort of what led you to those hypotheses. And again, 23 years of research, you kind of have to put it in different buckets. So I know we're going to get into that next. So if you could tell us just about your methods section, how did you design this? Once you realize we have 23 years to go through, how did you sort of bucket that into the different monkeys you used, and then how they were housed, and then, of course, what the different VAPs were? So go ahead, tell us about that.
Yep. So we had my undergraduate, Emery Lewis, who's co-first author on this paper, go through the medical records that we have for each animal. So for each animal, we document things like when the catheter was implanted, why it was removed, and how many repairs had to happen. And so she went through over 500 different catheters. It took her a year or two to do so, and documented how long each of these catheters stayed in, where it was implanted, whether the monkey was male or female or socially housed, as well as whether or not the catheter eventually developed a catheter tract infection. We actually separated these based on suspected and confirmed infections. So some of the monkeys had clear clinical signs of infection, so things like pus or not being as active as usual. And with that, we would take a blood culture and look at whether or not that catheter was actually infected. Sometimes lab staff would notice first that maybe there was some swelling around the vascular access port and choose to remove it before it had any clinical signs. And so she actually went through and looked at how many instances of these implants got actual infections and how many we suspected were infected. It was a lot of work for her to do, but it's a rich data set. One of the differences between our system and the one that was previously published before was that we used the subcutaneous vascular access ports. And we access these every single day during drug self-administration sessions. And we use a Huber needle with consistent aseptic prep. Something that we do with these Huber needles is because they're very expensive, we actually re-sterilize them. And so something we were interested in looking at is whether or not this re-sterilization would cause an increase in infection rates. And in fact, it didn't, which is really important for us and for other researchers using this type of system.
Great. So can you tell us just in general how many monkeys you surveyed? I can't even imagine, like you said, over a year, the amount of time to really go through these records, but kind of how many monkeys, and then what species and how they were grouped.
So we looked over 500 catheter implants across, I think, about 200 monkeys. I have to look back to double check. So we use both cynomolgus and rhesus monkeys. Our cynomolgus monkeys are socially housed in groups of 4, and we do this because we can look at the impact that the social rank has on drug self-administration studies as well as treatment efficacy. The rhesus monkeys are a little bit bigger, and so we can't actually socially house them in our laboratory, and so those animals are individually housed. So we were able to directly compare the impact that social housing had on confirmed infection rates, as well as how long those catheters actually stayed in the vessel.
Great. Thanks for that. And then can you comment males and females?
Yeah, I've got the numbers right here. So it was 300 cynomolgus monkeys were the data from, 99 of which were female, 201 were male. And then with the rhesus monkeys, we looked at 240 monkeys, 21 of which were female, not very many, and 219 were male. And if I could just add one more thing about the relevance of this, is the cynomolgus monkeys with this vascular access port, these are the monkeys at Wake Forest are the only ones on the planet that are socially housed in intravenous drug self-administration studies. So it really gives us an opportunity to study social variables along with the effects of drugs on the brain and behavior.
Yeah, we really appreciate that. Thank you for sharing that, because that could potentially be a big factor. And it's important to keep that in mind, especially as we go through the data. It's time for a quick break to hear about the AALAS Learning Library. Hey, are you ready to elevate your team's knowledge and skills in laboratory animal science? Well, the AALAS Learning Library is your one-stop solution for comprehensive training. With courses designed for everyone, you can train your entire team in one place, earn valuable AALAS CEUs and RACE CE credits, and take advantage of group discounts to maximize that investment. Getting started is easy too. Sign up for free to access select courses instantly to explore a vast library of resources. Empower your team, stay ahead of the field, and grow with the AALAS Learning Library, your trusted resource for laboratory animal science professionals. So I think let's just jump into your results. I want to tell you right off the top that I love figure 2. I love any kind of figure in our journals that are pretty easy to follow. And I really appreciate that you were able to put all of this data into some nice figures that are nicely presented and easy to follow. But I'll let you describe your data, your results, and kind of what you found.
Yeah, perfect. So out of the 500 catheters we looked at, we found that in the cynomolgus monkeys, the infection rates were pretty low. So they were 13.7%. And then in the rhesus monkeys, they were 10%. So a little bit lower in the rhesus monkeys rather than cynomolgus monkeys. Something else we found is that the infection rates were stable across the 23 years. And the average catheter longevity was roughly 22 months in the cynomolgus monkeys versus 15.5 months in the rhesus monkeys. So these catheters are patent for over a year, and in fact, closer to 2 years in the cynomolgus monkeys on average. And these infection rates we thought were surprisingly low given just how long these catheters are implanted in the vessel. And like Mike said, the fact that all of our monkeys, the cynomolgus monkeys, are socially housed. And this can increase the risk of contamination, and therefore these numbers are surprisingly low, and we attribute mostly to careful handling by lab staff to make sure they don't contaminate those vascular access ports when they do poke them. We looked at, like I mentioned earlier, whether or not the longevity differed based on where the catheter was placed, and we did find that there was a relationship here where the femoral vein catheters lasted the longest, which is not super surprising given that these femoral veins are larger than the other ones that we implant the catheters into. And we looked at the number of repairs. So sometimes, like I noted before, the skin integrity over the VAP can degrade over time, and therefore we have to move the vascular access port. And we found that more repairs were associated with a higher risk of infection in both species, which is again not surprising given that it is a surgical procedure. And then the final finding, which was surprising to us, was that the males were actually way more likely to have confirmed infection than the females. In fact, almost all the confirmed infections occurred in the male monkeys. And these results, we're not exactly sure why they were what they were, but we thought that maybe it's because these male monkeys are more likely to get into fights where injuries occur in their social groups. And so maybe that's increasing the risk of contamination to the VAP or the vascular or the catheter implant site.
I appreciate that summary. Thank you. So anything there besides what you mentioned really surprised you?
Definitely the finding about the males versus females. We do not have fights very often, so all of our monkeys are stable in their social housing conditions. But it's very possible that if there are slight squabbles, there's more bacteria being introduced to the surgical sites post-surgeries. I think that was the major finding that was surprising to us.
Sure.
For me, one of the surprising findings, by the way, figure 3, in my opinion, is the best figure in the paper.
It's too complicated.
If you just look at the confirmed and the suspected infections, they're so low. Like, that was the thing that surprised me the most, was that it was low a quarter of a century ago. It's pretty amazing. That was the most surprising thing for me. I thought there might be a learning curve. There definitely is a learning curve, but the folks in the lab were so good that it's been really rock solid over that entire time.
I really appreciate that. I think you're absolutely right. I would love to know if either of you have an idea of what these infection rates might be in the larger population of research monkeys or other species. I'm just putting you on the spot and wondering if you know. I myself do not know. I just wondered.
So that was part of the reason why we decided to look into this, because there's a surprisingly little amount of consolidated data on how long these intravenous catheters and vascular access ports actually last in macaques and what infection rates really look like, especially when they're socially housed. I also am not really sure what the infection rates look like in rodents, though I know in rodents these catheters do not stay in nearly as long as they do in these monkeys.
Yeah.
We'll add one more point. Yeah, that's absolutely true. Is we did have a nurse come up and meet with us who deals with chronic IV catheters in patients. She was very impressed with our SOP and our lack of very much infections in our monkeys. So again, I think we got validated by clinicians. So that was really very good.
Oh, absolutely. I'm sure they're kind of wondering, like, why can't we hit these low numbers? So I want to put you on the spot again. We would kind of love to maybe dig in a little bit more on your SOP as far as how was that developed and best practices. These clearly work. I would be remiss with not sharing some of that here.
We have a lot of stuff that's been gone through with the ICUCs to make sure our procedures are as good as they possibly can be. And right now, the procedure involves giving meloxicam as well as Cefsol, an antibiotic, prior to the surgery, and then making sure, the surgery is completely aseptic. And then following the implant surgery, we also put them on another antibiotic for 14 days. And we make sure the catheter remains patent by flushing it with heparin. And then once we start running them back on drug self-administration studies, we prep the vascular access port every single day. So we do a betadine scrub followed by alcohol, back to betadine, let that sit for at least 5 minutes before we actually access that vascular access port. And I think this sort of procedure is what really keeps these catheters in the vessel very long and the infection rate so low.
Yeah, I love it. Thank you for sharing that. I think if I didn't, I'd have some people mad at me. 2 thoughts I had from kind of when you were speaking there, Mia. And one was kind of how many, I think there's maybe 2 other factors, right? How many people are trained in the lab to do that SOP procedure was kind of like my first question. So maybe you could address that.
Yep. So in our laboratory, all the lab staff are trained to handle the vascular access port as well as do the surgery. So we actually all do our surgeries in the animals that we work with. And we have one head surgeon, Michael Collar. He's fantastic. He leads most of the surgeries and we assist. And later on, I actually did the surgeries and he assisted. And so that's kind of how the training goes. And then we all have a particular project that we work on. And so those monkeys are the ones that we actually handle the vascular access port every single day and sterilize them. So everybody in the laboratory is trained to handle these vascular access ports and conduct surgeries as their training continues.
Great. So a small group, essentially, which I think really speaks to the training and qualification of the person doing that. And the other question I had was just sort of kind of an old school question of time to do the actual VAP. We do know there's some correlation with time in a procedure like that. And I wondered if you have a pretty consistent time that you're trying to keep it under. We'd love to hear more about that.
Yeah, so in general, our surgeries are 1.5 hours to 2 hours, and we do actually redose with Cefsol if the surgery is longer than that time point, just so they get another dose of the antibiotic. And in general, that's mostly just because animal recovery is much easier if they're not under the isoflurane for longer than 1.5 hours to 2 hours. But we find recoveries very well after these surgeries.
That's really helpful just to sort of complete this whole picture. So thanks again for letting me ask those questions. All right. I can't believe we're getting to the end. I feel like we could talk about this for a long time. I don't want to belittle how hard work of going through 23 years of records is into just a quick conversation, of course. So just tell us, your discussion, you have some really interesting points in there. And I think it's always good to just kind of highlight some of those for our listeners.
Yeah. So our discussion just talks about the fact that if you use aseptic techniques and conduct your surgeries according to the protocol that we outlined in the methods, that these catheters can be maintained 1 to 2 years on average. In fact, there are some monkeys that had these catheters in for 5 or more years that were patent across that entire time frame. And the rates of infection in these animals, both the cynomolgus and rhesus monkeys, were low and relatively stable across the 23 years, even under conditions of social housing where contamination is more likely to occur. There might be a need to minimize the number of repairs that we can do just because that did increase infection risk. So trying to minimize the number of times that you poke a vascular access port in the same place would be a good step to try to reduce infection risk over time.
Okay, so Mia, I really appreciate that summary. So I want to ask you, in the discussion, you had some interesting points about antibiotic use. And I would just kind of love to hear from you and from Michael as far as in the tenure that you've been doing this, sort of your thoughts on the antibiotic use and maybe how it may have impacted looking at 23 years of this work.
So across the 23 years, we did have quite a few improvements in the actual SOP and how to take care of these catheters. And throughout those 23 years, the infection rates remained low. So it seems like these antibiotics actually were effective regardless of the type of antibiotic that we were using. And another note we made in the discussion is that when we see an infection or suspect an infection, we simply pull the catheter. We don't actually treat them with antibiotic because we're not sure if that's going to meaningfully extend the longevity of these catheters. And that's a really important empirical question, which future studies could address in our laboratory.
Oh, that's great. Thank you. I thought that was really an interesting point in your discussion. And I think that veterinarians and folks working with these animals would want to sort of know. So I appreciate that.
Anecdotally, it's absolutely true that I feel like when we try to treat a catheter tract infection in a cynomolgus monkey with an antibiotic, it doesn't work. We end up eventually having to pull the catheter. Anecdotally, I'm not so sure that's true with rhesus monkeys. And when you read that paper that was published in '88, the Taylor and Grady, they did document that when they treated catheter tract infections with antibiotics, the longevity of the catheter persisted. There is something different between a cynomolgus and a rhesus, and I don't know if it's because the cynos are socially housed or what, but anecdotally, I don't have any reason why it would be that way. I just feel that.
I love hearing that. I think it's important, and you've got a long tenure of doing this work, so we want to know what your thoughts are. I also wanted to ask just about the vessels themselves, and you have a nice note here in your discussion about the femoral vein versus others, and it'd be great if you could cover that too.
So the major finding was that the femoral catheters lasted significantly longer than the majority of the other vessels. And the biggest reason we probably think this is because the femoral vein is actually larger and easier to catheterize, so those surgeries do tend to be shorter. And the other reason is because we actually can insert the catheter way further into the vessel when compared to the other vessel. So if you think about the internal and external jugular veins, we can only implant it a certain length before we're going to reach the heart. The femoral vessel, on the other hand, you can insert the catheter way further in, and therefore it's less likely to come out as you flush it through the ears.
That makes a lot of sense.
And then there was one other point that we brought up in the paper, and that is that as we take these monkeys out of their home cages and put them in little primate chairs, they all wear collars. And so the jugulars are going to be bumped more often by those collars as they get put into the primate chairs.
Good.
And so maybe that has an effect too.
Yeah, that's a really good point too. Oh, I appreciate all of this. I can't believe we're coming to the end, but we are. And so I do need to ask you that one final question. Anyone that listens regularly to the podcast knows that this is kind of our hallmark thing. It's not hard to guess the question that I'm going to ask, but for you, Michael and Mia, we would like to know, what advice would you give somebody who's in a program, they really want to evaluate their indwelling catheters? And this doesn't necessarily even have to be for primates. It really could be for any species, although we know you have the expertise in primates. We would just love to know what advice you would give to somebody who's like, hey, how do I evaluate what we're doing?
I would say, first off, as a PI, my advice to another principal investigator would be the people that work with the animals know the animals better than any other person. And they are the ones that identify issues early on, just from observing their research subjects, because they know them so well. I mean, there are things that we can do, that you can observe in terms of, as Mia pointed out, we study operant behavior. That's a really sensitive baseline. If the monkey's not feeling all that well, it shows up on their performance in the operant chamber. We can, if we see decreases in food intake in the home cage, that's a sign something's not right. Lethargy, elevated body temperature. There are observable things that we can use to determine whether or not there are potential catheter tract problems. The other, as me and I were talking about earlier, making sure that you establish good metrics and you record all this information. It's so hard to go back later on and say, oh yeah, did we move that catheter? Keep track of everything that you're doing. And then I guess my other advice would be that if it's monkeys and you're doing chronic indwelling catheters, there are other institutions. There's us. You can certainly reach out to Mia and myself. There's colleagues at University of Mississippi, at Emory University, at University of Texas, San Antonio, at Harvard, that do very similar types of work. And they're all willing and able and very competent to help establish a good SOP for this.
I agree completely. Just to add to that, the other thing that I would suggest is just to plan proactively to try to reduce repairs and skin breakdown over the port, because that was directly related to infection rates. And so if you see an animal that you think might end up having an exposure on the VAP, you could try to poke around it and avoid that scab getting worse, which would significantly improve the outcomes associated with that catheter.
Oh, thank you for those. I so appreciate, I'm just going to start with you first, Michael. I so appreciate those comments as a PI. Thank you for kind of acknowledging the lab animal community, what we do. We know right now we're in a really tough climate with research, and especially with using non-human primates. And so we really appreciate as a PI how much you acknowledge that. And we acknowledge and so appreciate our PIs. So it goes both ways. So thank you. And Mia, thank you for that really great pro tip. You are a pro. And it is exciting to see just how well you all work together. So thank you again for being here. We appreciate it.
Will do. Thank you for having us, Jennifer. This was very fun.
Yes, thank you, Jennifer. This was really great.
Awesome. Thank you. Thanks for joining us on The Last Word, the official AALAS podcast dedicated to advancing laboratory animal science. We really hope you enjoyed this episode. To find out more about this guest or the conversation, download our show notes wherever you access this podcast. And please join us for our next episode. Until then, stay curious and stay connected.